I'm going to be talking about the Moro reflex now. The Moro reflex is used to help get the baby down the birth canal. As we talked about in the fear paralysis reflex, sometimes it works closely with the fear paralysis reflex. Sometimes they're called the duet. And the Moro reflex you'll see from about the age of 2 months to about 4 months before it's usually integrated. And it's closely associated with all of the senses in one way or another. So children that have a lot of sensory processing disorder issues or sensitivities with different like sounds or light or something like that, you're going to see oftentimes they've held on to the Moro reflex. It can also be associated closely with the vestibular system. That has to do with the balance in your middle ear. And so oftentimes it affects their balance a lot. They have coordination problems as well. Sometimes even a clap like this will elicit the response very quickly. And so oftentimes they have a lot of emotional issues going on. So a lot of emotional reactivity. Sometimes they're in fight or flight. One thing that's different a little bit with the fear paralysis versus the Moro is that in fear paralysis, if something happens, the child usually freezes. But in the Moro reflex is that they will fight or flight. Oftentimes they'll run away. And if they have both of these retained, sometimes they'll even go into panic mode because should I freeze? Should I run? They're not sure. And so then they go into panic mode. So those are some behavioral things that you might see with the Moro reflex, the retention of that. The fight or flight and emotional instability is a big one. These kids are up and down, tantrums, sometimes meltdowns, anything sensory, too loud of noises. They struggle with that, too bright of light. Sometimes if they're in a situation at an amusement park or something like that, it's almost too much sensory overload for these students. Here again, balance issues, problems with movement that you'll see with them as well. So in the next up and coming videos, you're going to be seeing how to test for the Moro. And I'll be talking a little bit more about some of the symptoms as well as the activities and the exercises that you want to use to integrate it.